USGS map and
Yeah.
just a dot here and there, and then Puerto Rico, you see the
Many,
small,
yeah.
you know,
Yeah.
and you know, I don't need to be an expert in earthquakes, but
To get to the well, and the thing about the earthquake, so
Yeah.
I'm also part of the minority health disparities work here in public health. And we just had an epigenomic conference last week, which talked about the impact of hazards on pregnant women and the outcomes on their offsprings and their offspring's offspring. And I don't think we've recognized that seriously enough in hazard mitigation. We've got the elders, we've got the young people, we've got these fertile females that we have to pay attention.
Puerto Rico, the problem is the infrastructure. You know, that's what killed people in the hurricane. That's what's gonna kill people in
An earthquake, yeah.
You know, and I think the last, I think FEMA modeling I saw was for a catastrophe plan that was done in 2012 or something, and you know, 48% of the medical infrastructure gone.
It's gone. That's what happened in Seattle.
Over 100,000 casualties there. You know, and I don't know. You know, I think we have to do something because we know about what's going on.
Yeah.
And you know, I'm there to help as a federal, you know, worker, you know, scientist, emergency coordinator, but you know, someone needs to bring this together.
Yeah, absolutely.
You know, it seems like everybody recognizes, but everybody's on
they're
their
not
own
doing
corner,
actionable data.
you know, barking at the thing. You know, okay, stop barking. Let's
That's
come
right.
together. Let's talk about, okay, what if this? What is the best scenario? What can we do for shelters, for healthcare facilities? What's the plan? You know, do some real things and stop, you know, playing. You know, all the eyes are going to be
All the red lights blinking, it's on.
federal entities
Oh, yeah.
for failing to
Well, and we have to take, the prize is not quote unquote resiliency, it's operating today.
But resiliency is, you know, people talk a lot about resiliency. Resiliency doesn't do nothing for you, you're dead.
That's
okay?
right, that's
You
exactly
know,
right.
It's a, you know, you can be the most resilient person. If that building collapses and kills you,
Yep, you're done.
If your family are gone, you're dead.
Yeah.
They're dead. You know, it's like a, let's talk about, you know, real concrete things.
Yep.
Because I come from the operational side of disasters. I've been doing disasters, you know, all my career with the CDC. And you know, and they said some beautiful talking points and things, but the reality
is
that
happens.
we need to do something. Stop talking about how beautiful this is or what science can do. You know, let's do something about it. Let's start somewhere. And you know, I'm in. You know, as soon as someone, you know, says bring the health sector, bring the health department in, we're in.
Well, and the new thing that was just rolled out, and I used it in the classroom last night on the lifelines, the community lifelines. And when you recognize that what and what, so what and what next is kind of like, that really stopped you in your tracks. Because if we're doing all this planning without thinking about the stabilization concept, and we haven't looked at stable ground, so doing the earthquake analysis is going to be critical.
Thinking out of the box. Okay.
Yeah.
We got, it wasn't a 7.5, but it was a 6.5. A lot of the infrastructure is weak, and here comes the next Maria.
Yeah.
You know?
Yeah,
So
exactly. You're going to have multiple.
We have to have a, you know, a outside the box thing, thinking, you know, what if this scenario is remote?
That's
but
right.
what would be our plan to deal with it? Because we thought things won't happen, and I was there for Irma, doing working on the assessments, and then Maria came.
Did it come?
And here it comes to hurricanes.
Yeah.
In 15 years, back to back, and one of the statistical odds, but that was supposed to happen, but you know.
Well, and then the tsunami side of things. So I was in the tsunami in Crescent City, California in '64, and then we had another one a couple of years ago, which I missed, but it didn't miss the town.
We did, you know, emergency management there, yes, they are trying to get these tsunami ready cities and all that.
Yeah.
But you go there and the siren is still knocked down.
Yeah. Yeah.
from the
before.
hurricane 2 years ago.
Yep,
They put a siren in a place, and they were talking about, we're gonna sound the siren and blah, blah, blah. And I say, well, I'm from public health, can we evaluate this?
Yeah.
How are you gonna evaluate? Well, we can do we have assessment methods to do a sample, a household sample, and find out whether they got the message. They
Yeah.
hear the siren, do they know what to do?
yeah, what does the siren mean?
That sounds wonderful, you know? And we did it, and they're like, oh my God, like I said, this is so simple, you know? We're not coming up with some
Yeah,
rocket
it's not
science
rocket
here.
science,
These
yeah.
are methods that exist, but because we don't work together,
Yes,
you know? But I happen to be at a meeting and say, can we do an evaluation on this? Say, how are you gonna say? We have methods to do assessments and evaluate this, cluster sampling or whatever. And we went ahead and did it, and then we did the presentation, and the NGOs are like, this is what we need to do. Look at these things, evaluate them, you know,
Yeah.
not just talk and talk, you know. And you know, it was a very interesting moment, you know.
yeah, yeah.
But that's the kind of thing, and that's why we need to integrate, you know, we talk a lot about scientists in a lab, in one side, various managers in another,
Yeah.
you know. We all have to work together.
Yeah,
you know.
yeah, and the class I'm currently teaching, the role of transportation emergency preparedness, it's half emergency preparedness kids from the emergency school, and
Yeah.
the rest are my mainstream planning students who only think about the good day.
Yeah.
And the emergencies only think about the emergency, so getting them to think about long-range planning
Yes.
together has been
Yes.
really exciting.
And it has to be multidisciplinary. You can just get the public health guy with the emergency manager, and you know, it has to be engineers, and there have to be, I don't know, weather guys and transportation people,
Yeah,
because bridge collapse.
yeah, exactly, exactly.
But have people think about that. You know.
Yeah,
So,
and getting our students to
Yeah.
be involved in that, not an exclusive framework, but one that's more inclusive.
Excuse me, I'm gonna get in here now. Let's see. Mhm. Let's see. You are right. Okay. How do you pronounce Hakami? Hakami. Okay.
Oh, okay.
Definitely put me up in my
There you go. Let's get it down. All right, I'll be upstairs in the boardroom.
Okay, is everything looking okay over there? I'm just here to help out with it.
Yeah, I'm trying to see. 1, 2, 3, 4, 5. We got 6 speakers. One of them, I guess, didn't send their stuff. How do I get them in order? So, show them. Is there any way to get some air in this one?
Some air in this room, not that I would be able to control or know of. I just want to be putting on these people.
And it was hot.
It is a little hot in
It
here.
was hot last night.
Yes.
Yeah, I noticed that.
Was
soon
it
as I
too
walked in.
hot?
I don't know.
I feel like you can open up that door for a little bit, but then it might start getting freezing in here. So you were in this room yesterday?
Yes.
Was everything?
No.
I was in, but before the workshop where this hot.
Oh, it was hot. Was everything working for them, like as far as the mics, the computer, sound?
Yeah, but they were doing mostly workshop stuff, so they didn't really need, but it did.
Yeah.
Hi, how are you?
Hi, hola. Looking for you today. Well, let's up here for a while just to get ready for this. Hi.
Hi, I'm part of the panel, coming up in about 15 minutes.
You are
I'm Stuart.
now from the National Weather Service? Yeah, okay. So you come in last on the panel and I'm just loading everything.
Okay, yeah, and I know I got back from my vacation literally 2 days ago, so I had to upload stuff and scramble to get stuff ready.
Don't worry about it. Well, moving to this. So, just here we go. Okay, this. How you doing? Okay. So you go in first? Yeah. And how do you pronounce your last name? Guthartz. Michael, how do you pronounce Michael's? Michael Pino? It's a little warm in these rooms, have now. Open the door. If it gets too cold, then you know.
Well, we can definitely tell the temperature
Can you-
change.
Are you, because I don't feel it even here. Oh, no, I just felt it now. Okay.
Yeah.
I was like, wait a second.
We'll just drain the heat out, but don't let the facilities people see us do this, they'll get
So where was
upset.
the conference last week?
Yeah.
Yeah, it's kind of, I don't know.
Hey, how you doing? Good.
Glad to see you're here. It's funny because I had, Michelle asked me, and said to Mark, we suggested, and then I got another one here.
Yeah, it's a little touch and go there, it's a little bit, but it all worked out.
This is Dr. Primo.
Oh, I'm just a
Director
mister.
Primo, yes.
How you doing, Mike Primo?
How you doing, Miguel, from the CDC?
Nice to meet you, Miguel.
Nice to meet you, sir.
I'm good.
Mike, we don't have a presentation, huh?
Nope.
Okay, good.
I'm gonna run my mouth. You know, that's good or bad. You all decide.
You're all good at that.
Some people say I'm good at that. I don't know. I don't know if that's good or bad. Oh, you guys keep inviting me back, so either you can't find nobody else or it went okay.
Well, we can close the door.
Yeah,
Close the door.
yeah, yeah, cool it off enough, yeah.
Somebody can get up and walk in.
Never get it to
That's right.
You're
Gold
wet or you
box.
freeze, and it's
Yeah,
right in
right.
between.
I kept seeing you in seconds.
Huh?
See seconds in the lineup? Do you have an order?
Yes, it's Seth, it's Mike, Dr. Lin, then Samantha, Penta, and then you, finally Mr. Stuart. Is that it?
Let's do it again. Sorry.
Yeah. It's Seth, it's Mike, then we got Michelle, then Samantha, and then you, then finally Mr. Stuart. Huh? I mean, any order that you want, flexible, just let me know. Because I have the other presentation, I'll open it.
I see you. Is everything good? Everybody good?
Make sure we can shoot on the screen.
Sure. All right, so we're just going, is this your PowerPoint?
That's the first
And are we-
seven.
And how many?
Yeah, on the,
Well, no, are these all?
yeah, it should be five. Yeah.
These names look right?
No, that's, Riley, now.
Yeah, Gary. It was kind of a shock, especially after coming off the deal.
Perfect.
So we're all done here, and the first one is. Okay. So I'll hit slideshow. When you hit from the beginning, then it pops over the screen.
Okay.
Yeah. AmeriCorps. Yeah, we were here at AmeriCorps together. Is that clicker right here?
Mm-hmm.
Use the button. Because part of my new role. So
Good. Let's go check on Jill. I'm gonna go over the cancer center and check on, we're at 375.
Okay, I'm just gonna make sure.
You don't want me for 4, so I'll check on you at 5. I'll check on the ballroom at 5 o'clock.
Is there anything we can do against circulating here?
I can call, but by the time they get here, the conference will be over.
Okay.
Actually, it's 442-3480. That's the number you call customer service. 442.
Okay.
They want that.
All right.
Yeah, presentation. Getting ready to kick it out the door. Or spectrum of preparedness.
I was wondering if this was going to get worse and you will get called to you. That's nothing. In Atlanta, that would be a declared emergency.
Outside of my area.
Okay, well.
Yeah. So how's Coach doing?
Coach, I told you yesterday that he's doing well. He's, he's a Swiss Army knife, you know?
Yeah,
He wants to do everything, and sometimes you have to pick some battles you can win, you know, and you want to show that you are, hi.
Hi, I'm Sam.
Sam,
Nice
good.
to meet you.
Good.
Do we need anything to sign up?
No, we have all the presentations here, and we're just gonna line you up on the order that you're going to present and do the intro, the little bit of a short bios, and then we go from there.
Perfect. Do you want us to sit down now? Or?
I mean, it's still
Okay, no worries. It's just walk it out.
So his whole family moved down?
yes, the guy loves it. He's a surfer.
Yeah, no, I know.
So he really surfing this afternoon. He loves it.
I was with, so you heard about during Carnival when the shooting? Okay, so during the Christmas Carnival in St. Croix, there was a shooting. We were all there. And so, like, a couple of us had just thought, we had just arrived the day before. And so that night.
We're thinking Las Vegas in our active shooter.
Well, yeah, then there was an active shooter. Four people got shot that night. And we were there and I was with Dr. Davis. I was like standing with her people when it all happened, and they didn't know what was going on. And we were crouched down in between the big health department vehicle and the Vitima truck. We were right in between, and it was like being in that. I forgot about that until yesterday. Someone mentioned having a shooting, and then having to deal with like regular emergencies. But we kind of drop in, and all of a sudden, we're safe from the disaster and all the things from. But I was with Natalie Grant and all the and all those folks from HHS, and
I love that. Olivia, like friend, she comes and she's like punching you.
Oh yeah.
Yeah, Miguel, you know that, are we gonna do this? You have big nose.
Well, she's a she was a very
Olympic athlete,
Olympic athlete for Jamaica.
Yes.
She's amazing. And I met her during Sandy when she was in New York City. She was for a while. She was one of the HHS coordinators.
Yeah, I met her during FISA, Federal Graduation Support Acts, from some stuff that she's doing, talking about recovery. And, we met in Puerto Rico, and then Josh Barnes, and he's now moving on to small business.
Yeah. Well, she's moved on. She's at administration. But within HHS.
Either her or Ethier. Really smart and very well, kind of,
And speaking of power also.
for 1 minute, will ask my panelists to please.
So do we sit, can we sit here and watch the?
Yes.
Then we can move later, right?
Good idea. I like that. Like 25 Yes.
I said no last time, so
Okay, I got your bag. I got everybody's bag.
and also they put the signs here.
Yes, yeah. Okay. What time you got?
No, set a timer. 13.
We're gonna have the panelists sit and so they can watch the slide.
Sure, okay.
Showing us the idea. Okay, good afternoon. My name is Miguel Cruz. I am an emergency management operations officer with the Emergency Management Office at the US Centers for Disease Control at the National Center for Environmental Health. And I'm going to be the moderator for this session. So we have prepared an excellent panel of presenters consisting of disaster emergency managers and scientists. So for this panel discussion, we're going to focus on what more effective actions or strategies are needed during disasters. Each panelist will share their experiences with health-related planning, response, and recovery. So they have about 10 minutes each, so be conscious of the time. So our first two panelists are from the public health emergency management area. Dr. Seth Guthartz is a seasoned emergency manager and responder. He's currently the director of the Office of Emergency Planning and Operations for the Division of Environmental Health at the New York City Department of Health. Then we're going to follow with Michael Primo. He's the director of public health preparedness and response at the New York State Department of Health. Our third panelist is Dr. Xiao Ling. Dr. Ling is a professor above the Department of Environmental Health Sciences and the Department of EPI and Biostatistics, School of Public Health, University of Albany, and she is also the Associate Director of the Global Health Research Center. Dr. Lin will provide recommendations on how to improve disaster data collection and how to improve public health surveillance during a hurricane or disasters. Our fourth panelist is Dr. Samantha Penta. Dr. Penta, she is an assistant professor of emergency preparedness in the College of Emergency Preparedness, Homeland Security, and Cybersecurity at the University of Albany. Dr. Penta will discuss the interprofessional collaborations in disaster health and medical services. Our fifth panelist is Ms. Mary Riley-Jacome. Ms. Riley-Jacome is a project coordinator at the University of Albany School of Public Health, Center for Public Health Preparedness. Her focus there is on implementing and evaluating emergency preparedness core competencies and training for the public health workforce. Ms. Riley-Jacome will provide recommendations on how to improve community outreach and interventions after natural disasters. Our last panelist is Mr. Neil Stuart. He is with the National Weather System office in Albany, where he works as a general forecaster. Mr. Stuart will discuss improved weather forecasting to allow earlier and more target warnings of an approaching hurricane or storm. So with that, we open the floor. Our first presenter is Mr. Dr. Seth Guthartz. Please welcome Dr. Guthartz.
Thank you. I just one correction. I'm not a doctor, but I've done a lot of faking of various things. So at one point I did go to fake medical school, and another time recently I went to fake law school. As Miguel said, I'm the director of the Office of Emergency Planning and Operations for the Division of Environmental Health, the New York City Health Department. My office prepares the about 1,200 staff within the New York City Health Department to respond to environmental health hazards, hazards involving chemical, biological, radiological weapons, as well as the chemical, biological, radiological, non-weaponized hazards. We have a fair bit of responsibilities for preparing for coastal storms. So I'm going to give you a walk through some of our response operations. I'll show you some pretty pictures. When